Welcome and thank you for joining today. We're talking about the ODMAP system. Mark Tuttle from the Department of Health and Human Services at Eastern Band of Cherokee Indians is going to give us a brief overview of, the ODMAP system today. So let's see, housekeeping tips. We have a survey that I'll post in the chat box towards the end of the session. If you could fill it out, it'd be really helpful for us. And we'll have the overview and then we'll open it up for questions. And you can go ahead and take it away, Mark. Let me give you access.
Okay. I believe, Vicki, did you want to speak before and give any overview of your side?
Just very quickly, I just wanted to give a shout out to Mark because he's our expert specialist, our subject matter expert on ODMAP, and let you know that there is a lot more that can be done with ODMAP. At EBCI, we are in the process, our criminal justice department is, of applying for a CTAS grant. We have a platform, Barrington Software builds that out for us, called our Hopewell database. So we are trying to merge ODMAP and create a hub so that we can expand the use in the tribe. Currently, it's tribal EMS, but we want to expand it to our hospital emergency department, police department, fire department, that kind of thing. And so part of that grant is actually working with, it would be working with the ODMAP developers to incorporate and intersect our hub with what they're doing. So I'll just turn the time over to Mark. He's done a great job. He's our epidemiologist here at EBCI. We're so fortunate to have him, and thanks for joining us today. Hi, Dr. Brown.
All right. So this is just going to be a real quick overview. I'm not going to go too in depth, but I'll just share my screen here. Okay. Can everybody see that? All right, how about now? Can you all still see it now?
Okay. We are seeing the presenter view, so we may be seeing the screen. If you have two screens set up, we're seeing the other one. You can either go to display settings or you can stop sharing and reshare and then just share the other screen.
Oh, okay, gotcha. So let's stop share and reshare. Okay. There we go. I think that should be good. Okay, so ODMAP stands for Overdose Detection Mapping Application Program. So go to the next slide here. There we go. So what is ODMAP? It's a near real-time overdose surveillance system that supports public safety and public health efforts to mobilize immediate response to overdose spikes. So we say near real-time because you don't have to enter the data immediately. You can backdate it to whenever you have free time available. So say you're law enforcement, fire, EMS, you go out on the scene, you're too preoccupied and you want to just enter the data later on that evening or the next day, you can do that. So it allows first responders to track known and or suspected overdoses as they occur. So, and if you are on the scene, you can use the mobile application. You can just pull it up right on your phone, enter the data that way. And it can be used tactfully in the field, like I just said, mobile device or office computer on that, or be added later. It shows overdose activity across multiple jurisdictions, and it has the ability to upload data and view maps in real time, and it provides free of charge to first responders and government agencies. The general public does not have access to this system. but I'll show you a little bit later the map. It's considered the level 2 map. So you can see everyone who's utilizing ODMAP. So all the data that they put in. Okay. So ODMAP provides near real-time surveillance of suspected overdose. It's used to collect and store generalized geographic data points. So it just stores it and you can see it on the map. That's basically all it is, it's just a storing. ODMAP, they provide different assistant, liaison, coordination, resource assistance in collection, storage, dissemination, analysis of the data. And they enable participating agencies to develop effective strategies for addressing overdose incidents occurring in their jurisdiction. ODMAP enhances the development of regional strategies designed to prevent the spread of substance use disorders resulting in overdose incidents. Okay, so here are the two screens that you'll see when you enter the data. So the first screen on the left, so that's, I'll show it to you once we go to the website as well. So you'll just enter the information right on there. And then as soon as you click on one of the either a non-fatal overdose or fatal overdose, one of those buttons, then I'll bring you to the next screen, which the next screen is this over here, the incident location information. And there you enter the incident date and the time, and you confirm that the location is correct. And then after you click on that, it'll even pop up a warning if it's been entered previously. So the data is entered into the system by the officer, fire, EMS provider, and the user identifies incident was fatal, non-fatal, whether or not naloxone was unknown, administered single or multiple dose. We'll look at that a little bit more later. A simple one-click system, while case information is optional, it is advised that you indicate the following: at least a primary suspected drug, and if the victim was part of a multiple overdose incident. Okay, now I have a little video for y'all to watch.
Hi everyone, my name is Elise Alter and I'm the ODMAP Program Manager for the Washington-Baltimore HIDA. Today we're just going to do a brief overview on the Level 1 platform, which incorporates the most recent updates from the most recent release of ODMAP in May 2019. Once you come to the screen, you will just click Login once you enter in your appropriate credentials. And for any of those of you who are unfamiliar, this is the screen where suspected overdose entry takes place. There are 3 different methods in which you can enter in an overdose. You can either use your device's location, you can use coordinates such as latitude and longitude, but the most popular method is by utilizing an address. It's important to mention that if you utilize an address, it's not stored within ODMAP and you cannot go back to find that address again. So if we use an address to enter in a suspected overdose, we will go ahead and start typing in our address. And you'll see that as we type that the box is red. Once we select our address, the box will then turn to green, letting us know that the system has accepted it. The only other fields that are required other than location to enter in a suspected overdose is whether or not it was fatal or non-fatal, the corresponding naloxone, and the date and time. This information and case information is optional. However, you do have the ability to enter it in if you'd like to. For primary suspected drug, you would just select one drug, which is the primary drug. However, you can select additional drugs, and you can do so by selecting the first one and then holding down the control button and selecting as many other drugs as you'd like. If there is a drug that is not listed and pre-populated within these fields, you have the ability to select other and then to enter in a free text form. We'll continue entering in our suspected overdose. We'll select the appropriate box. We will click it, and then we would just need to select our date and time. We'll just verify that the location appears correct on the map and submit it as a correct location. ODMAP also has the ability to detect possible duplicate points. Prior to this training, I went ahead and entered in the same location. And so if, for example, that first location that was entered by law enforcement on scene, and then the one we just entered in together was entered by law enforcement, we would have the law enforcement agency's information, the person who entered that overdose, to hopefully serve as a warning that that person you were just on scene with has already entered that overdose. However, if we determine that this is a completely different overdose, we have the ability to submit this location anyways. ODMAP detects duplicate points within 285 feet and within the past hour. We have the ability to manage our overdoses. So for example, if this overdose that we just entered in together, we need to go back and update some information in it, whether it was the incident type, for example, we can just select that, and then we scroll down and click save. It will again continue to warn us that this could be a possible duplicate point, and we can again override that information. We can also delete this suspected overdose if it was incorrect or submitted in error. It will continue to alert us to make sure that we're sure that we want to delete it, and we can just click delete, and now it is no longer there. You can also search your records within the ODMAP Level 1 platform. And so you can select incident type, drug type, or you can also sort by a specific date range. Whatever you select, you'll then click search. And then below here, it will correspond with your selections. It will populate those on a map, and it will list them down here below. And so you can see the fields that are here. And again, no location via address is entered, just our latitude and longitude. And we can also export that from Excel directly from the ODMAP Level 1 platform. We can also manage alerts. And this is where our most recent release incorporates some exciting new features. We have our standard spike alert, which traditionally you could only set a generic spike alert, which encompassed both fatal and non-fatal overdose. Now we have the ability to create spike alerts by both fatal, non-fatal, or both. So we'll walk through setting up a spike alert together. You will still select your state, and then you'll select the county. You can select if you want either spike alerts by fatal, non-fatal, or both. And you'll see that the system still gives you a recommended spike alert threshold based off of data which is in the system. The formula which ODMAP utilizes is a formula of 2 standard deviations above the mean. You can also continue to select a threshold that you determine is most appropriate. And you'll just enter in your subscribers here, and then click create. A new feature is that you can automatically update your threshold based off of data which is in ODMAP. So for example, if currently a threshold makes sense of 6, however, next month, due to a change in the environment, it should be 7, ODMAP will automatically update that for you. There is a new feature called an overdose alert, where you can create an overdose alert and be notified every time that a fatal, a non-fatal, or both are entered in a given county. And so these are created just as our standard spike alerts are created. So we select again, and if we want to be notified every time that a fatal overdose is entered into Baltimore County, we'll just enter in our information and click create. An exciting new feature is also a statewide spike alert. This creates an alert for an entire state, so that if any county in that state is experiencing a spike, the user will get an alert. The incident type is defaulted to both, so it encompasses both fatal and non-fatal overdoses, and this cannot be changed. The threshold is also set to be automatically updated by default, and this cannot be changed, and it is utilizing that standard formula of 2 standard deviations above the mean. So we would just select our state of interest, enter in our subscribers, and then click create. Lastly, we can manage our users. This functionality remains the same, but just as a refresher, we have the ability to create additional level 2 users. And again, this can only be completed by agency administrator. As a reminder, an agency can have as many administrators as they deem appropriate, and those administrators are responsible for overseeing the overall users for those agencies. Since we are in the training environment, we can't see any active level 1 users. However, if you're an agency administrator, you would see them here. You'd have an edit button. You just click edit and then click administrator to give out additional administrator responsibilities to other users within your agency. Agency administrators also have the ability to create level 2 users for their agency. So they would just type in the name here. They would type in the email address and a phone number, and then they would click create. They'll be notified that this could take between 1 to 2 business days for a level 2 user to be processed. And then if a user happens to leave the agency, be transferred, or no longer needs access to level 2, they have the ability to unapprove those users, and they will all show within their manage user selection. Any users which an administrator unapproves will always display within this page, and the administrator can always reapprove that user, and they will show and reflect here. That concludes our demonstration of the level 1 platform. As a reminder, you can also view our policies and procedures. There's a quick link to ODMAP level 2. We also have our new feature here to leave a suggestion for the ODMAP development team. And you can enter that information here. And as a reminder, odmap.org has some information as well to include additional links to some of our training materials. Thank you again for joining, and please feel free to reach out with any questions or concerns.
Okay, so that was the level 1 training. Let me show you the actual website now. Okay, so this is the website that you would go to get to ODMAP. And so we're at the home page right here. So as soon as you log in, it will show just like this. So she went over all these. You don't have to enter case number. We don't enter case number here for EBCI, but we do enter the age, gender, primary suspected drug, and all the other information on here as well. Then a reminder, you can select multiple ones on here. If you just hold down Control, you can select multiple ones on there. So now I'm going to go into the actual level 2. So they're changing it around a little bit. It used to be a whole separate link, but now it's located right in here. So that's why it's beta, but it's going to be the main one right here. So as soon as you load this, it shows all the suspected overdoses in the past 24 hours in the United States that have been entered onto ODMAP. And this is just agencies, states that actually use ODMAP, so not everybody. But you can zoom in on here. Let me pull this over a little bit. So like right here, so this is us. So yesterday we had an overdose. It's Eastern Cherokee Reservation there, it says. And so this is as far as you can zoom down right here. And then if you want to click on it, it will show you it's a non-fatal multiple overdose or multiple dose naloxone was used. And that was entered by our Cherokee Tribal EMS. And suspected drug was heroin, and there was no other suspected drugs. And it was at Sunday at 6 p.m. there. So, but that's just for the past 24 hours. So if you want to, you can use these filters. I'll go over the filters in a later episode, but you can just, here, I'll just do this. So you can do, say you want to look at the past, or do the past quarter. And states, go North Carolina. Oops. Then agency, here we are Cherokee Tribal. Okay. Apply filters. This over here lets you know it's running. So this is from January 1st till now. This is how many overdoses that we've had. And so over here it says 9 suspected overdoses in that time period, and 9 were administered naloxone. And there's also different little things here you can look at, some data points here. So day a week. So Sunday, Monday, Wednesday, Tuesday, Thursday. So Saturday was our largest one for this past quarter. Then goes hour of the day. You can also export all this into Excel as well. So we can go over that a little bit later in a different episode. And that's a suspected overdoses per month. So January we had 5 overdoses. February we had 3, and so far in March we only had 1. So I think that's all that we're going to share for today, and we'll open it up for questions. So if you all have any questions on this, feel free to ask.
You can either type in the chat box or unmute yourself.
Hi, this is Coleman Cox with Cherokee Nation in Tahlequah, Oklahoma. I was curious about agency cooperative agreements in order to be able to get access to the data if you yourself aren't a first responder or law enforcement agency. Could you speak about how you went through the process to do that?
Let's see. Vicki, do you want to chime in on that, or?
We have an administrator at the tribal level, and our administrator is at tribal EMS. So right now it would be up to him to give you any privileges to view that data. So I think probably what we will do as we go forward is we will have an MOA with those agencies that are currently inputting the data, and they will provide a list of people that would have access to view it.
Any other questions or comments?
You may have already addressed this, Mark, but if someone is there in person, are they entering this with a smartphone app? I see that you're on the web browser. So, you know, if you're back in the office, you could enter it in after the fact, like you mentioned. But if someone's right then and collect entering this information, is there an app, or do they have to use a web browser, or how does that work?
They can use the web browser. So just pull it right up on your phone and just enter it just normally. You can pull it up on mobile version, basically, of the website. Then you'll just enter it right onto there. and you can set it to get the GPS coordinates on your phone. So as soon as you type it in, if you're using the mobile phone, it'll get the coordinates from that.
And so if you didn't have cell service, then you would need to put
Right.
it in later.
Yeah. Go back to the office and put it in later. Correct.
Hi, Mark. I have a question. This looks really cool. You know, I love maps. So you know, it tickles my map gene or whatever it is. But what practical use have you found with it so far, or have you found any so far? I mean, it's interesting to see where these are, but you know, how does it help, I guess, is what I'm trying to.
So we have a syringe service program. So we're trying to use it to kind of look at different areas. We have a mobile syringe unit. So we want to look at the different areas that are more hotspots in order to take it around to there. So that's one spot that we're trying to look at, and just trying to see the actual overdose data. Before, we didn't have access to data on
Right.
overdoses. It was just so, like, they go to the hospital and they don't get diagnosed properly, doesn't get entered in the system properly, or so it's just, this is a good way to actually see the data and to see like the trends, see what day of the week or even the hour, or what the different like say heroin's more popular in the community, maybe it's more popular in a certain area of the community.
Mhm.
And so like during the lockdown last year, right after that started, there was a huge spike. We had a huge spike. And it was mostly due to fentanyl in the community right during that time.
Mhm.
And so I was like looking at that, and then I talked to our syringe service program administrator, and they were like, yeah, we're seeing a lot of this stuff going on. We're hearing about it too. So it's just communication with different agencies as well. A lot of agencies kind of want to know what's going on in the community. So in order to help address the situation.
Yeah.
It's a great harm reduction tool, Harry. Like Mark said, when you see that, oh, look, in the last 2 weeks, we've had 14 overdoses and they've all been fentanyl, then you
Yeah.
can alert syringe services staff, like Mark may tell them, you know, this is what we're seeing. And so they communicate that to their participants.
Mhm.
You know, what we're seeing, hey, listen, you know, be careful of your size, the size of your shot, because there appears to be fentanyl and there's been 14 overdoses in the last 2 weeks.
Yeah.
That kind of thing. So it's a great harm reduction tool if you use it like that. And then it also, if you want to inform law enforcement, it's a great tool because it will identify clusters. And if you're seeing, you know, this area of the community, there's something going on in this community because we've had, you know, 10 overdoses in the last 2 weeks and they've all been within a 5-mile radius, then you can kind of say, you know, are they dealing and using close to their dealer, or is it, so it gives you an opportunity to monitor. And it just trends, you know, ODMAP was one way that it really showed, you know, that during per capita distribution, we see an uptick and we see the types of drugs that they're buying during that time.
Yeah. I mean, I'm being a little bit, I wasn't trying to be a naysayer. I can, you know, it kind of reminds me of Jon Snow. You know, he did this very same thing way back, you know, the father of epidemiology, when he drew a map of all the places where there were cholera cases, and that's how he figured out that it was coming from the water or from a particular pump. And I think Eric had the same thought that I had. You know, would you maybe use this to distribute naloxone?
It could be used for
Okay.
that. So right now we have the syringe service program. So the participants all go up there and they can get the naloxone for free. And plus we have the mobile units so they can get it right off of there. And if we use the map to look at the different hotspots in the community to target those hotspots, then we can distribute the naloxone around there.
Yeah, that's what I was thinking. Yeah. The time feature of this is really, I think, an extra that could give you some really meaningful insight. I noticed that, 2 a.m. and 6 a.m., people have been up all night partying and now they decide they want to go to sleep. So they take a hit and maybe go to sleep forever if they take too much.
Yeah, it's usually right around 9 p.m. we saw like where it starts to spike up even more.
Yeah.
But another interesting thing is we backdated data. So we started like 2 years ago using this, but then we backdated another 2 years. So our EMS, they had the data stored away. So they just entered that into the ODMAP. So that's possible too. If you have the data already stored somewhere, then you can more see the trends over time.
It does dispel some perceptions. You think most overdoses would probably be at night when people are partying, and that's exactly what we see, Harry, is they're not. And they're not on the weekends typically. It's like you see, we just noticed that for a while our overdoses seem to be occurring like Tuesdays or Thursdays. And so it may, is that when the supply is delivered,
Yeah.
into your community that way for law enforcement too. That's why we want to get law enforcement and particularly law enforcement involved to be able to look at the map and input, because they look at it with a different set of eyes than say a health provider does.
Sure.
But it gives insight into, it's like, okay, suddenly on Tuesday mornings around 10 or 11, we're seeing a number of overdoses. Why is that? Well, it gives the agents an opportunity to start investigating, are they buying on Tuesdays? Are they buying on Thursdays? And because they typically use immediately after the supply is delivered. Just really interesting things you don't think about otherwise.
Yeah.
And I was curious, in addition to the distribution through the harm reduction program, the Syringe Service program, is patients who are being prescribed it by their primary care provider, if they're on a opioid, pain prescription, getting that to them. Obviously, they're not being prescribed fentanyl, but are the overdoses that if you're seeing overdoses that are requiring multiple naloxone doses to reverse, has that influenced, or do you see that being an influence on the number of doses of naloxone that either say the pharmacy is handing out or the prescriber is prescribing to their patients, if there is consideration around maybe those patients mixing in other opioids or other drugs?
Yeah, I don't know that we've made that correlation, but I do know that looking at the data, most of the overdoses here take more than one. And so we, at our Syringe Services program, we dispense 2 at a time, and they can get as many as they want. They just need to come back and tell us, I've used it. And we do ask them, when did you use it? And we ask with all of the daily dispensing of syringes, one of our questions is, do you have naloxone? Have you, or have you used naloxone in the last week? How many doses and what was the scenario? They're very forthcoming with that information. And they're not looked recently, but it was most take at least 2 doses.
And most of the overdoses around here are from heroin and meth. So we don't see a lot from the other prescription opioids.
So there's a lot you can do with it, but even though, I mean, we started and a year into it, of course, we went into shutdown basically. And so we haven't been able to expand and get the other programs on board. That is our intent. It is some of our deliverables with our opioid response grant with our CDC collaborative. And then the Justice Center, like I said, is writing, we have a tribal action committee here now. And so that group is writing the CTAS grant to expand this to other agencies so that it can be much more useful for our community, because the more people that have access, the more innovative we become with looking at this. And of course, everyone's like, okay, this, you know, we're seeing this, and the police have ideas about maybe what's going on. Healthcare has ideas. But once that committee is fully involved and all those people are sitting around the table, then it helps us develop action items on how to combat the use.
Do we have any other questions or comments for Vicky and Mark? If not, let me post in the box. If you can fill out the survey that I just put in the chat box, it'll help us with future programming. Oh, Stephen does have something.
Yes. Thank you for that, Mark. And looking at ODMAP in the first stages and deciding if it was something that you wanted to utilize, were there any other systems that were similar that you looked into, and how did they compare?
I don't think we looked at any other systems. It was just ODMAP. We didn't. So we were applying for a grant for CDC, and they actually mentioned ODMAP as one of the tools that we could use to identify different overdoses in the area. So we kind of sought that out, and we liked it as soon as we saw it. So we went after that.
I apologize if I'm asking too many questions, but I was curious, just posted in the chat, you know, I don't know if you did, but if you had first responders who are resistant to entering in the information, how did you address that? Was it kind of through education, through their supervisors, getting the buy-in from the maybe chief of police or fire department, or how did you have any issues with the rollout amongst the individuals who would be collecting this information amongst the EMS?
No, no, they were actually very on board with it, because we all knew we had a lot of different meetings talking about the overdose situation in the community, and they're saying the numbers are a lot higher. We know the numbers are a lot higher, but nobody actually had any data to back that up. So they actually really were on board in getting this started for us.
Yeah.
Mm-hmm.
I had another question. Thank you, Eric, for mentioning that. My question is along the same lines. In your area, you're seeing a large need for this service. You're seeing a large number of overdoses and the need to respond to that. For communities who are trying to be proactive and get ahead of this situation with heroin and fentanyl, like my communities, did you have any like best practice type of documents that you developed that we could use locally in our communities to help promote the need for this? Or have you seen anything like that we can use locally to gain support with our lawmakers, our law enforcement agencies, tribal leaders, things like that, so we don't have to reinvent those talking points?
You said for Syringe Services, Coleman?
For ODMAP or for Syringe Service programs, and there's a number of things Cherokee Nation is looking into at the moment around harm reduction.
Yeah, we have a lot of talking points, and we're glad to share those with you in terms of our legislation. You know, we had resolutions, we've had limited sovereign immunity. I mean, just a lot of different laws that we put on the books to help support, and just tons of data. I tell you, one of our best resources for data in the initial beginning to help convince our community and our tribal leaders was just the North Carolina harm reduction site. They've got some great fact sheets. I don't know what Oklahoma has, but you could go to North Carolina's. Talks about, are people more likely to use drugs if you have a syringe services program in your community? And and it talks about the percentage of law enforcement and public safety that get needle sticks without a syringe service program, that goes down. There's just a lot of really good information, but yeah, we're glad to talk to you more about that. It was a whole kind of a community education campaign.
Wonderful. If we could connect sometime soon on that, I'd like to do that. I'll
Yeah,
drop my email in the chat.
Dr. Montero, we offered, if you know, if you ever get the green light to develop a program, you're welcome to share our operational documents, our policies and everything.
Super.
You can come visit anytime.
Yes. Come back. I enjoyed my visit last time in fall of 2019.
Right.
Back.
Okay, well, if there's no other comments or questions for Vicki and Mark, we can go ahead and end. Just a reminder to fill out the brief survey that I posted in the chat. Oh, I'm sorry, Eric, you did you pass a resolution for in support of ODMAP use?
No, I didn't feel like we needed to. It wasn't going to be cost prohibitive because it was free. You know, the initial access is free. And I think that's one of the reasons, one of the big selling points. And our tribal leaders actually want to know, they're like, how many overdoses do we have? You know, we're investing millions of dollars in our continuum here. As you know, we've built out a huge continuum. So what are we dealing with? Are we seeing these overdose rates go down at all? And so this is a good tool. Hopefully we can trend that kind of a, you know, longitudinal model so that we can really begin to see the changes after we have put all of the infrastructure support on the ground. This is just another tool to help look at that over time. But no, we didn't use it. We didn't feel like it needed legislation. It was just an internal operational programmatic function that we would do. So.
Okay, well, seeing no other questions or comments, we can go ahead and end this session. Just a reminder to fill out the survey to help us with the future programming. Thank you all. Thank you, Vicki and Mark. Next month, we'll be doing the history of ODMAP and request for access. Thank you all.
Thank you.